So, welcome back to the People's Transformathon. My name's Helen Bevan from the Horizons team, and I'm one of the co-chairs of the People's Transformathon. We've had 5 hours of amazing content already, and we're now moving on to onto session number 5. And I'm here in Coventry, in the West Midlands of England, and I'm very pleased to be joined by some local activists, actually. And by an activist, we mean people who are changing the world, and that's very much happening. So we've brought a group of leaders today. We've got Dawn Nicholls and her son Ben. We've got Melissa Smith, who is a community activist, and we've also got Mel Smith from Grapevine Coventry and Warwickshire. And what they're going to talk about, we're going to have a conversation about the work that they are co-producing that challenges the notion that, people, activists have to be better beneficiaries of change, because actually they're leading it, supporting carers to take the initiative. And they're working under the umbrella of COV Mind the Gap, which is about informal community, utilising informal community assets to meet need and provide support. So, Dawn, Ben, Melissa, Mel, over to you.
Thank you, Helen. It's really lovely to be here. We were hoping that we would do this afternoon or this evening was kind of be in conversation with one another here today, if that's okay. So it might not be as structured as some of the other sessions that you've had, but hopefully we'll fill our time with wonderful stuff for you all to hear. So whenever we sort of get together or we're meeting new people and in the work that we do, we really believe in the why of what people do. So we're each going to start off by saying why we're doing what we're doing. Is that okay? I have to big up Simon Sinek for this one, because he understands the power of the why. So for myself, I'm a parent as well as working at Grapevine. I've got a son who's 23 years old, just with a learning disability, and really, for me, my why is that I believe in the power of being connected. From our personal experiences with my son, it brought about a huge culture change in our family, and now we're co-producing his life within a connected community. So just as my role with Grapevine, we are hugely passionate about how people connect into community, because we know that it helps people to have really good lead really happy, healthy lives. My values, I suppose, are really aligned with the organisation that I work for. No surprises there, really. And the way that I first got involved with Grapevine was actually as a service user, and we went to them in crisis, and they basically showed us a very different way of working, which was really to understand the power of being connected and how we could actually co-produce a better life for our son. And I'm going to hand over to Dawn now, Dawn and I have been working together for a while now. She's an amazing parent. She's part of, we're funded by Public Health, and we run a parent leadership programme, and Dawn is an amazing parent leader. We're just checking that you can hear Dawn, by the way.
To find their way, and really quite similar to Mel's story, this was born from my family's journey. I'm a mother of 4 absolutely wonderful children, and 2 of our boys have special educational needs. All the children are absolutely fab. They're fun, they're caring, they're unique, and we love them for their individuality. Life at times has been like a tornado. We're never quite sure what's left after that storm. But once the calm is restored, that we regroup and find strength from our community to make the future even better. And some of the things that we'll share later on will be my story, and hopefully Ben will feel comfortable to tell some of the great achievements he's done.
I'm going to hand you over now to Melissa, who we've given the term community activist today. No pressure there then.
Well, I'm actually liking my new title, so I think that one might stick. My why is basically born from when I was diagnosed with a rare spinal condition, and it thrust me into a new life where my diary was full of hospital appointments and follow-up calls instead of being able to go out and have fun with my friends. I started to grieve the life that I had and really want it back. I was in a pretty dark place at the time, and I don't know whether you know this, but the other Mel that's here is my sister, the lady that works for Grapevine. So, sorry, I think she just said that, didn't she? So, yeah, thankfully she came along and introduced me to a different world of storytelling, call to actions, community mobilisation, and a whole heap of new friends. All of a sudden, my life had purpose once again. We worked on building a community of people who came together to take part in activities that were scientifically proven to promote well-being and increase the feel-good factor. We called this little venture the Feel Good Community. Fast forward a year and the majority of the core Feel Good team all have disabilities, and we're co-producing events that will take us through till the summer months. And the reason that we're putting these events on is that the community felt that during the winter months, the cozier months, people struggled with depression and just lacking motivation. So we're here to help people during the winter months. So if you'd like to take part, please do get in touch. We do have a walk on the 4th and a hoogie night. Quick plug. I've always wanted to do that. So please do get in touch. We'd love to hear from you.
So it's back over to Mel again now, and I do like someone who just did their own little cheeky plug there, but I think it's brilliant to be able to promote some of the stuff that's happening here in Coventry as well. I think that what really drives our passion and our work around this is that we, well, I'm a big fan of Edgar Khan, and his book's called No More Throwaway People. And I think the thing that really helps us to strive towards doing things very differently is that we realise that we're entering very difficult times. There is no more money. In fact, there could be less. And there are increasing pressures both in demand and numbers. And we really do need to think about how we deliver things differently. So our question is, what if we did do things differently? That different doesn't always have to mean less or worse, or that it's any less professional. And how do we really use the rich resources that sit within our communities in the form of people, hearts and values in order to bridge that gap or mind that gap that we so often see there? So we're going to talk a little bit this afternoon about some of the work that we're doing here in Coventry, all under the umbrella of #CovMindTheGap, if you'd like to join us for some conversations over there too. And the first piece of work that we're going to talk about is something that Dawn's really involved in, and that is parent leadership. You all right, Dawn? You ready? So basically, the way that we sold ourselves to public health, the way that we were going to deliver this work, was that we were going to use the untapped knowledge and experience of the parents that we knew, alongside the knowledge and experience of professionals, to really understand how we could shape future services. I think that very often what happens is that when we're talking about co-production, often people think that if we just ask a group of parents to get some other parents together, that is co-production. Well, our ideas around that are very different. And I think from my experiences of meeting the array of parents that we've got involved is that actually most of them could do my job, they could probably do your job, and very well indeed. And we need to be using that untapped resource that we've got sat there in the community to really help us think how we shape things in the future. So I'm going to pass over for a little while for Dawn to be able to talk about parent leadership and her experiences with it, and what she feels that she's experienced from that and learned from it.
I'm just aware that the slides are actually behind what we're saying, so so I became a parent leader about 5-6 months ago, and was a bit of a strange concept because I'd always been really engaged with the boys' extra needs and been in and out of services. I actually gave up at work a year ago to help my boys transition into secondary school and into other different provision. But I wanted to do something a bit more to be able to tell my story and use my skill set really from my corporate life. So part of the parent leadership side was actually saying that how could we use our skills out to actually shape services. So some of the work that we've been doing, that I'm sure for the people who are in Coventry on the call know that we've got a big change that's happening with the Connecting Communities project and big changes to our children's centres, libraries and youth services. And I was very passionate about this because my eldest son Ben, he's actually part of the youth, uses the youth services as an outreach programme, and they're going to change the absolute shape and form of this. But also as a parent leader, they asked us to get involved with that the nurseries are going to close, but obviously when you're going through consultation, it was actually a proposal that was put forward, and actually the parents in the most vulnerable areas of the city didn't understand that this proposal could mean closure. So the group of us have been working at different children's centres across the city to actually with the nursery parents and to help support the staff as well, because they're at threat of redundancy with it, to actually say, well, we're independent, make sure the parents have the voice, make sure that they can actually contribute into the consultation process. And how we went about that was actually there were two messages that I thought was really important. One, how do they manage that change and what's the impact of that change to their family? And the parents have been absolutely amazing that we've helped them fill forms out together. We've used speech bubbles. We've worked as a group together to really perfect the way that we're getting the parents' voices out there. So that it was a very small thing that we could help with, but seeing the empowerment of the parents to actually understand what they can do for their kids' future, it just helps me share a bit of my past experience and put my voice out there.
Thanks, Dawn. I think we're okay just for a moment. I think that some of the really interesting learning that's come from that is definitely around the questions of the redesign of services and how parents help to co-produce that, but also that some of the parents are saying, actually, you know, how do we make sure that the service development doesn't create dependency, and we're not forgetting about, you know, this rich resource in the community that we've got out there, and if we don't make use of that, we'll just have very much of the same of what we've already got. The other thing that's come out of that is the question, and I tweeted about it earlier, which is, does co-production mean the same thing to parents and professionals? Because very often, you know, what we hear from professionals is, can you gather a group of parents? They're not really thinking about the value that that parent can bring. And interestingly, with this piece of parent leadership work, what we did in the very beginning was that each of the parents created a profile. And I think when you're trying to co-produce, it's really important to think about, A, what real skills and assets have those parents got and how do we utilise them? And also, what do those parents want to get back from it? Because if we forget that, then we're never going to get to a stage where we've really got true co-production going on. And we've got a fantastic group of parents that are involved at the moment, and we're sort of shaping the future of how it's going to work. And what we're trying to do is build up a self-sufficient group. And it's just recently they all decided on a platform where they could communicate, which has been really interesting for me because I can watch their conversations and their relationships develop on a Facebook Messenger group, and the way that they support each other as well through that group and throughout the consultation is fantastic, because it means that very often one of the difficulties with co-production is the amount of time people have to dedicate to it. So we're going to move on to talk about the other ways that we co-produce things in the work that we're doing at the moment. And
we've been doing some work with Naomi Brooke from Public Health. You should follow her at Healthy Nemo, and also, yeah, Healthy Nemo. Yeah.
Is that okay? At Healthy Nemo, and basically they commissioned us to do some work about getting people more physically active in Coventry. I'm also working alongside another wonderful lady called Ruth Nelson, and you can find her on Twitter at Nelson Ruth. Doing a few cheeky plugs here, sorry. And I'm trying to get 1,000 followers, so if anyone could help with that, that'd be great as well. So I'm at Grapevine YP. So I'm going to go on now to talk about how do we actually co-produce with people, what ideas did we come up with for how we could gather groups of people together. And basically when we first started the work, we realised that we've got all these people with great ideas, but they hadn't necessarily got the capacity or the resources to be able to make them fruitful. So Naomi and I went out for a walk one day. We're very into walks and talks and trying to persuade lots of people to walk and talk instead of having meetings behind desks as well. And we came up with the idea that we would run ideas factories. And the ideas factories are exactly what it says on the tin. We invite people to come along to contribute their ideas to what a more active and inclusive city could look like. The meetings are very fun and informal, and we usually begin with a story. With big ones for stories, and you'll see why a little bit later on. And then it's over to the group to share ideas and to see what skills, ideas and connections could slot into a bigger picture. And we've seen some fantastic results from this. So we brought all sorts of different people together from all different walks of life to think about the kind of things they'd like to see happening in Coventry. So far we've got Swim and Tonic, which is a group of people who like to connect and do lots of swimming together. We have Slow Roll Coventry, which is a slow cycle ride around the city that happens once every fortnight. We have Feel Good Community. She did a plug for herself earlier, and I'm going to hand over to Melissa to talk about that in a moment, about her experience of the Ideas Factory and how she felt that we managed to co-produce some of these ideas together. We always meet in a pub, which people smile at, and someone said to me the other night, is this really your job? But I think that part of being able to relate and co-produce with people is all about the relationships that you can set up with one another, and very often the informal way of the Ideas Factory means that people come without feeling nervous. They feel that they can walk into an environment that feels fairly friendly. They hear a story or two, and they mostly feel inspired by what they've heard. So Melissa, do you want to say a little bit about Ideas Factory and how your ideas come to fruition?
Hi there again. So if you remember earlier, I said that I was diagnosed with a long-term health condition, and it was at this point that Mal had invited me along to go to one of the Ideas Factories. Being a sister, I agreed, but I had no idea of what it was about. So when I got there and I heard all these stories, I thought, quite liking the sound of this, and would like to be a little bit more part of it. So what was different with everybody, though, was that they had a story with a call to action, and I only had a story. It didn't have a call to action. And what the Ideas Factory helped was for me to create my call to action and for me to develop the Feel Good community. Oh, okay, sorry. So, yeah, that's what we did. We had our first event, and the community mobilised around the first event. It was a cold, blustery, windy day, and we met up at the Memorial Park in Coventry. There were 33 folks and 3 dogs, and we did a walk of the park, and we all had lots of fun, and afterwards everybody thanked us for doing it, because I think sometimes people want to do things but they don't like organising it themselves. So somebody had come along and said, this is what we're doing, meet us here, and everyone agreed. So what we left with a bigger call to action was that people wanted more events. So since then we've had more events, mobilising the community once again, and like I said earlier, we have an event on Sunday, and you're more than welcome to come along.
It's all right, it's
Melissa, could you tell us how you built up a group of people that actually, so that you don't, very often I think what happens with co-production is if you haven't got the right people helping you to co-produce stuff, then it becomes very difficult, and you feel like you are, as Many of you may, if you've seen the leadership video about the lone nut, you don't want to end up being the topless dancer on your own forever, but you want people to join you. Ben's giggling here. So I think the important thing about the way that Melissa has gone about setting things up is that actually she's built a power base, a group of people, most of them actually with learning disabilities, who like to meet up about once or twice. Yeah, and they come together to plan events, and it means that, talk about the different ideas they've got. They wanted a flash mob at the next one, but we don't know whether that's going to happen at this one or not yet. But the key thing is that actually the very people that should be the beneficiaries of this kind of thing are actually the people that are leading it. And again, using our analysis of some of the communication feeds that you've got a messenger group, haven't you?
The groups are really a good way for us to communicate between each other, and it's just nice as an added benefit, really. So, you know, we'll send each other messages, how you getting on, how you feeling today. You know, if somebody's feeling a bit down in the group, then that gives us opportunity to perk them up. So, yeah, it's definitely good to open up different ways of communicating when you're trying to co-produce. And Facebook groups, Messenger, WhatsApp, anything like that is really, really a good idea to set up.
Yeah, so the slide that we've got on at the moment, if you can see it, there's one of our favourite people there, Jill Phillips at Who Shoes, if you want to follow Jill as well. Jill's been really supportive in the work that we do and always talks very kindly about us. But the picture that you can see there is a group of parents, all parents who have children with special educational needs and disabilities. And MenCap released a report about how parents were really stressed out during the holidays. It was the most difficult time of the year for them, and it's the time when they'd often go into crisis. And I shared that with a group of parents and said, what do we do about this? Do we sit and wait for services to help us and to support us, or do we start to plan and co-produce our own ideas around what could happen during the holidays? So that picture there is a group of us meeting together, and we've got some plans for the new year, some stuff happening hopefully in February. And I think the key is that, you know, they will be the leaders of the change that they want to see, and that's been really important throughout all of the pieces of work that we've been doing as well. That's enough probably about Ideas Factory. We're going to give this a little bit of context now as well, because not only do we invite people to come along and be part of the Ideas Factory, but we also look at how do we get people thinking about what it takes to be the leaders of the future. And we run something called the Innovation Factory. And again, this is turning out to be something that is a co-production dream. On the left of the little picture there, you will see Dawn. She's actually, when she came to the Innovation Factory, if I just explain a little bit about what that is, it explores ways to engage, mobilise and build capacity for future action, something I'd never heard of before I started all of this work. I used to organise things and hope for the best and think that everything would be fine. But I understand now that the crafting of a very compelling story, using campaign charts and understanding who the people are that I need to engage with are just some of the ways that I can do this more effectively. And these are the kind of approaches that are championed by Marshall Gant's social movement approaches, championed by him. And so we offer 2 days of training that cover all of the things that I just said, and Dawn came to one of the sessions. So when you come along, it's not all commissioners, it's not people working in public health, there's a real mix of people. We've had Ollie Benson came to a couple of the last sessions, and we also invite members of the community to come along. So Dawn came along. What we wanted was, thinking about Dawn's leadership role, was for her to engage in this and see how she felt. And when we told her that we were going to use stories as a way to engage people, she was slightly perturbed at this and said that she couldn't do it, and gave us, you'll see there, one of her quotes. I'm so glad I spoke out and gave my feedback, as it was an amazing experience to eventually co-deliver the training. So basically we listened. Dawn told us that it wasn't accessible for her and she needed to think about that in a very different way. So Dawn became one of the co-facilitators of the last lot of training that we've just done, and did it very well indeed, and is definitely part of the planning for the next ones, and has already been sharing ideas with us about what that should look like. And I think that's key to co-production, that very often there's some interesting people within your sphere who can actually help you to think about how you might grow and change things so that it's more applicable for more people. Are we running out of time, Helen, or are we okay?
Yeah, we've just about run out of time, but it's so fantastic. But probably about another couple of minutes, if that's okay?
Yeah, is that okay? So that was the quick stop, pit stop innovation factory. I feel like we're on this, can we change the slide please? I feel like we're on this fantastic bus that's taking us through a quick pit stop of all the things that we've done. So finally we're going to come to the umbrella for all of this work came about when 4 women got together and decided that we needed to do something about the gap that we saw in between services in the community, and the hashtag #CovMindTheGap was born. And basically CovMindTheGap is it's how we involve informal community assets and capacity in meeting need and providing support. It just doesn't save money, it gets better solutions that improve lives. It's a kind of economy, a system of change and support. And we've been all over Twitter with this, with the help of Jill Phillips, who's I think she's the reason that we got 60+ million impressions on the hashtag. We've learnt a lot from Jill, but CovMindTheGap is basically bringing people together to think about how we look at what's happening in that gap and how we can do something about it, and start to use the very precious assets that we've got in the community in order to be able to make sure that people are having happy and healthy lives. So much to say about CovMindTheGap, but final sentence? Oh, God, what can I say about this? It's amazing. Oh, Ben's just amazing. Do you want to say something, Ben? No, he's too shy.
Yeah, I think it's amazing. Tell you what, Mel and colleagues, I'll maybe say the last word for you, if that's okay.
Yeah, that's brilliant.
Yeah, which is that, in the same way that Mel is talking about using the assets of the local community, well, the little team that are supporting the People's Transformathon today are the Horizons team, which are part of NHS England. And if there are other people on the call who are health and care professionals, your organisation probably has a volunteering policy like NHS England does. So what's happened is our little team, which is Coventry based, is actually working with Mel and Grapevine and CovMindTheGap. And we've got a goal that every single person in our team becomes a formal volunteer using the NHS England volunteering capacity, and we're actually part of the assets of the community that are helping CovMindTheGap. And it's really fantastic for us as a team and our well-being that we can actually do that. So it works both ways. So, my goodness, that was a whistle-stop tour. We've run out of time now, but I just really, to thank all of you, to thank Dawn and Melissa and Mel and Ben for coming in and telling us about the fantastic work of CovMindTheGap. Thanks so much.